Magandang araw po. Ako po si Jerome N. Ibayon mula sa Animal Science 3C. Ngayong araw po ay discuss ko ang isa sa mga swine disease na kung tawagin ay swine dysentery. Simulan ko na po. Swine dysentery is a mucohermogenic diarrheal disease of pigs that affects the large intestine. Swine dysentery has long been recognized as a major cause of loss to pig industries throughout the world. Pigs shed organisms in blood feces. Organism survives 4 months in cool damp conditions, spread on boots. Asymptomatic pigs can shed for months. Mice shed bacteria more than 200 days. Etiology and pathogenesis. The essential causal agent is Brachyspira hydrocenteria, anaerobic spirochete that produce a hemolysin, although other organisms may contribute to the severity of lesions. Swine dysentery most commonly affects pigs from 8 to 14 weeks of age. Any age of may be affected. However, in adult swine, the disease is not as severe and may be difficult to diagnose. It is proliferates in large intestine and cause degeneration and inflammation of the superficial mucosa, hypersecretion of mucus by mucosal epithelium, multifocal bleeding points on the mucosal surface. The organism does not penetrate beyond the intestinal mucosa, decreased ability of mucosa to reabsorb and indigenous secretions from the unaffected small intestine results in diarrhea. Signs and symptoms. Dysentery may be confused with other pig scoring problems. The first symptom is a bloody diarrhea after a time, and the feces becomes watery and contain a thick mucus. Weight loss, fever, and refusal to eat are other symptoms. About 20 to 30% of the hogs infected die if the treatment is administered. Chronic infection results in slow rates of gain and poor feed efficiency. More commonly, a mucodiarrhea with flecks of blood and mucus develops and progress to a watery mucohermogenic diarrhea. After several days, the feces are brown and contains flecks of fibrin and debris. Diarrheic pigs are dehydrated, profoundly weak, gaunt, and emaciated. These are the pictures of a feces contain blood in mucus. This is mucodiarrhea. Excess mucus or blood in feces are signs of swine dysentery. Mucus flecks of whitish, fibrin and variable amounts of blood are found in the puddling or watery feces. These are the pictures of affected pigs, often exhibit loose feces giving a dribbling appearance under the rectum. The typical pig affected with swine dysentery will appear dull, depressed, and inappetite with sunken or slab sides to its abdomen. These are the typical picture of typical blood mucoid product of an affected pig. Diagnosis. Clinical signs and necropsy findings are usually sufficient for a presumptive diagnosis. A positive diagnosis of swine dysentery is made by laboratory analysis of feces samples. Differential diagnoses include intestinal spirocatosis, proliferative enteritis, salmonellosis, and heavy whipworm infections. Lesions. The diffuse lesions are confined to the cecum, spiral colon, and rectum. The affected mucosa is covered with a layer of transparent or gray mucus, often with suspended flecks of blood in early stages, with a mixture of blood fibrin and necrotic debris in more advanced cases, and a yellow necrotic debris late in the course. Treatment and control. Therapeutic use of antibacterials is effective if started early. Water medication is preferred at first. Because drug-resistant strains are prevalent, it is essential to choose a drug to which the organism is sensitive. Bacitracin, Carbodox, lincomycin, tylosin, thiamulin, and virginiamycin, etc. are commonly used. Thank you po. Muli po ako po si Jeremy Bawen mula sa BSA Ansay 3C. God bless po.